The first thing we're going to look at today is what we call conventional film. So some of you may remember conventional film from your past experiences at the dental office. This is what we used to take all of our x-rays on before digital radiography became very, very popular. So this is the Insight, and these are, this was a box of a number 1, but the ones I have out here are number 2. So when we are looking at our actual conventional film here, you're going to see, as it says here, opposite side towards the tube head. And what that means is that the exposure of the x-ray is going to be on the back side here. So when it's placed in the mouth, it has to be that side is facing towards the PID, or the position indicating device and tube head. This side here is going to be facing the tongue side of the mouth, or the intraoral portion of the mouth. So here we have the front, here we have the back, and here we're going to take a look at the different layers. So the first layer we have, you can see it folds open, and then I've taken it apart here. So we have our plastic barrier, and this is the outer plastic vinyl wrapping that goes around the whole film. And this is to help keep moisture, saliva, anything liquid from getting in and disrupting the film. Next, the layer we have is a black piece of paper. And this black piece of paper helps to protect the emulsion. And it's on both the front and the back side. As we open it up, you'll see here that there's an inner portion of that black piece of paper as well. Inside that black piece of paper is the actual film, the x-ray film that's going to be exposed. Okay, so it's very sensitive to light. So it has now been exposed to light, so it will show up completely black if I was to process that. Next, we have our lead foil. And our lead foil, as we know, is to help protect the client from extra backscatter radiation. So it helps her reduce the exposure to the rest of the mouth from the radiation from penetrating through one side to the other. And how we know if we have a backwards image placed in the mouth, when you actually process this film, you will end up seeing what's called a herringbone, and that's those little tiny dots and grooves on the image. So that means that you expose the client with the wrong side facing towards the tube head as opposed to the opposite. Now, a lot of offices you'll see have gone away from our conventional film. The reason being is digital is a little bit more time sensitive. You're able to view the image a lot faster. There's no chemical processing, so these images have to be put through a chemical processor with fixer solution as well. So it does become costly in the sense that you are processing, and you have to also maintain all of your equipment in terms of your processing. You have to have a dark room, so again, space is an issue, and that is so that the film itself does not get exposed to light. If you do have a dark room in your office, one way to check if there's any leaks is to place a coin and complete the coin test. You leave a coin on the actual film packet for approximately 1 minute, and then you process. If the actual film gets exposed to any light, you will see the outline of the coin. Another thing too, as we'll see, I'm going to explain some different aspects. These are a one-time use film, okay, so it's for one client, one exposure. After that, it gets put into the client's chart and maintained for record keeping for up to 10 years past the age of 18 or their last appointment as per record keeping guidelines. So we're going to stop here with this video, and we're going to move on to the next one.